Bismillah ar-Rahman ar-Rahim. Your Highness, Excellencies, respected audience, ladies and gentlemen, good morning to all of you, and thank you, Hanan. Hanan is not only a colleague, but also she is a leader of health, and she is also a director. She's a Harvard graduate, by the way, she didn't tell you that, and she is also the director of a collaborating center for infection control in the National Guard and also for GCC countries, and collaborating well with the World Health Organization and also with the CDC. I would like to thank you for this introduction. And let me start, being a pediatric surgeon, I will start with the conjoined twins. And Your Highness, I really enjoyed how you brought scouts to this actually gathering. And also I really compliment His Majesty for adding the name Messengers of Peace. And this is well respected name and which we value, but also I should also equally compliment the health workers. And if I'm allowed, I would like to use the words of His Majesty that the health workers are also the messengers of life. Those twins, by the way, have His Majesty has been actually the driving force for this experience of conjoined twins in Saudi Arabia. The experience have reached now more than 66 cases and sponsored by His Majesty. And to show you how His Majesty is so lovely and unlikely for children, he visited most of those children after surgeries in a fatherly and actually humane touch for each of those twins. Now let's go back to work. Now the history of health in Saudi Arabia is fascinating. It only started in 1926 when the first primary healthcare services was initiated, and in only a few years the development was slow. It wasn't till the 1950 where the first landmark of the Ministry of Health was created. Before that, it was only a department of health in the Ministry of Interior. And the first Minister of Health was His Royal Highness Prince Abdullah Al-Rabeeah. After that, there has been tremendous progress. And to show you the progress, between 1970 and 1990, you see the tremendous increase in hospitals, in working force, and also in primary healthcare centers. And also it doubled again between 1990 and 2010, and we have probably to achieve the same in 2030. Now, even training was only recent in Saudi Arabia. It wasn't until 1993 when we have the first Saudi Council for Health Specialties, which is equivalent to the American colleges of different specialties. Now, I think you should know about the law of Saudi Arabia and the mandate of Saudi Arabia. Article 5 or Chapter 5 of our basic law, in Article 27, that the government guarantees the right of health care for citizens and their families in cases of emergencies, sickness, disability, and old age. In Article number 31, the government is responsible for public health in the kingdom and provides healthcare services for every citizen. Also, the mandate of the Ministry of Health, which is established in 1950, dictates that it guarantees the provision of primary healthcare services to all citizens, and also provides secondary and tertiary services, and also develops and implements plans to ensure the provision of healthcare services. Now, this is, I think, if you want to talk about progress of health, look at, I think all of us agree that the health indicators which has been approved by the World Health Organization are the key figure for success. It's in 27 years, we have moved from low numbers to numbers which competes with international standards, and I think the numbers speak for themselves. Also, our fights with the contagious and infectious disease. You know, Saudi Arabia is a country where the two holy cities, Mecca and Medina, are, and we receive visitors for the holy activities from more than 165 countries. So we have to be more than active in infection control. And you can see our numbers showing themselves by declining numbers, which is an evidence of success. The same also for diseases such as polio. We are a polio-free countries. We will be eradicating all types of measles within the coming year, which will be the third country in the world which eradicates measles, and the same applies for tuberculosis and others. If you look at the vaccination, actually, we are one of the top 5 countries in the world where vaccination has approached 98.8% of children aged 1 year and older. The health services in Saudi Arabia is spread between 3 main sectors. The bulk is the Ministry of Health, which gives health services to 60% of the population. The other government agencies, whether university hospitals and military hospitals, provides 20% of the health services, and the private sector provides 20% of the health services. Now, like all countries, we have challenges. We have challenges of increasing expectations of our citizens. We have also the same challenges like all countries of increasing costs and also limited resources, and also how we deploy our resources effectively, and also our geography. Like the United States, we have a large country, and if we compare population to population, we have a vast country with many challenges and expectations. And also the sustained growth, and also, like all countries of the world, the changing disease pattern that pose challenge for the health workers. Now, the costs, you can look at those graphs. It's clear that looking at Saudi Arabia and the United States, and you see between the years 2002 and 2010, how the costs have been driven quite high. Also, the demand is increasing. We have an increasing growth of population. Our population growth rate is around 2.8. We hope that it will decline a little bit in the future. We have also the same factors of aging population. The more we succeed, the more we increase the cost for health. And chronic diseases also pose a challenge. Psychiatric illness also is a challenge. And also we have another big challenge, which is road traffic accidents, that I'll talk about it later. Now, we have almost close to 28 million now. And in the year 2020, we are expected to be around almost 40 million. And we will double our population above the age of 60, which is going to significantly increase the cost for health. I think we share something in common with the USA. We managed to compete with the USA in obesity. We have 33% obesity rate and 17% diabetes rate. We rank next to U of A in diabetes. If you look at the contributing factors for chronic illness, contrary to most countries, road traffic accident stands first. We lose more than 6,000 young population each year from road traffic accidents. And also, we have an epidemic of lack of physical activity approaching more than 34%. And unfortunately, smoking, instead of declining, it's going up. We have limited resources of bed capacities. And also, we are, like most countries, looking for professional staff to improve our health parameters. Hospital beds, just to tell you that the acceptable standards is 3.5 beds per 1,000 population. We are now at 2.2 with our plans, which I'll show you later. We are aiming for 3.5 per 1,000. However, the United States is not far from us. They have 3.1 beds per 1,000 population, but we cannot compete with Japan, where they have 13.7 beds per 1,000 population. Physicians per capita, I think we are close to the bar, but we have to do a little bit more. We are a little bit lower than the USA, but we are not doing well with nurses. I think we should do more with the nursing staff. And also, this is the challenge. And I'm not sure who is right. Is it us or the United States? Or both of us are wrong? we are only giving 3.4 of our GDP for health. I feel it's not enough. However, United States is spending 17.4 of their GDP for health. And if you look at the beds, we are not far from each other. The same thing for the number of physicians. So either the United States is spending too much, or we are spending too little, or both of us have to do something to be in the middle. However, if you look at the satisfaction rate, a recent survey done by an independent worker, our satisfaction rate for patients is 70%. And my understanding from our friends in the United States that the satisfaction rate is not far from our numbers. Now, per capita expenditure, we're not doing well. We are only spending in the Ministry of Health $531 per capita. However, I think the USA is overspending, I think close to $8,000 per capita. And the private sector, either there is a shift to the left, which is too much private, or shift to the right, too much public. Most countries believe that the ratio should be between 70 and 30%. In Saudi Arabia, it is 80 to 20. Now, we have to do better for deploying our resources, which I mentioned, and we have studied also the effectiveness of smaller hospitals, where we have found the hospitals below 100 bed capacity is not productive, and actually they pose the challenge for patient satisfaction. And this is actually can tell you that occupancy rates goes higher with larger hospitals and lower with smaller hospitals. So that that's changing our strategy for the future. And this is to tell you the ratios in the Ministry of Health. Now, we did not forget quality. We have actually gone through the challenge of accreditation and also putting priorities for our resources and also improving the infrastructures for our health facilities. Now, in our health reform, we have studied carefully 35 health systems, including those in front of you. And we have come to the conclusion that we have to move to the concept of integrated comprehensive healthcare system, which is ICHC. In the past, most of the health systems used to run around the hospitals, unfortunately. But they have forgotten the focus, which is the patient. Now, we have moved to focus on the patient, and that's why we believe that our focus for all of our health reform is the patient. Now, today, we are working haphazardly and just thinking to build hospitals, but in the future, we want to have a system where each province of the country has a base of primary health care system, followed by secondary and tertiary systems in an organized referral manner. And those initiatives gave us 8 points. We have to develop and also restructure our hospitals. We have to improve our primary healthcare services. We have to improve and automate our referral systems. And also we have to develop our air and land ambulance systems. And also we have to invest a lot on our e-health. My friend, Minister Abdullah Al-Rabeeah, he mentioned to you that we are investing close to 3 to 4 billion US dollars in the e-health initiatives. Also, develop the human resources, which is an integral part of the health system, and also ensure adequate supply of pharmaceuticals and the implementation of accreditation and quality standards. Now, in the past, we are moving in a rectangular manner. We want to move in a pyramid, with the base being primary care and then moving towards the quaternary care. Now, we want to actually reorganize our primary healthcare, which is the base for any good healthcare system, and to reform not only the buildings and structures, but also the mandate and the function of our primary healthcare centers. Also, our referral system, within 2 months, we will be launching one of the largest automated referral systems of any country. It will be a national referral system which should be referring patients from different villages and cities two bigger hospitals, being public or private, and we will start it in a pilot study, and then it will be implemented nationally. And also, we are going well with our electronic automation, which I will allude to later on. Our main objectives is to provide adequate also transportation, and also effective resource utilization and coordination and integration, and also improving our existing services. I think all of you know the importance of e-health. We have gone through a strategic planning for our e-health reform. We have put that for tender, and it was won by IBM, and they have put for us a 5-year strategic plan, which is available for those of you who are interested, which is put it in a phases based on the integrated healthcare system of Saudi Arabia. Our e-health system strategy is being phased into different phases over the coming 5 years, taking actually initiatives such as cloud computing, national e-health standards, and also hospital information systems, and patient satisfaction, patient referral, Saudi PAC system, and the rest of those initiatives. We have also future plans for our e-health strategy, which will not forget most of the health information systems for the hospitals, and putting 5 major data centers in most of the medical cities so that they will have an e-health recovery plans. Now, accreditation is an important part of our both public and private healthcare system. We already started accreditation through our national accreditation program called Sabahi, and we have started with the Ministry of Health, and next year we will be starting implementing that on our private sector. We hope within the coming 4 to 5 years, all hospitals in Saudi Arabia will be accredited, and also we are collaborating well with the JCI of the United States. Our goals for our integrated healthcare system is that we should have an easy and timely access to care, comprehensive medical care services, automated referral system, equity to all levels of care, and proper transfer and referral systems. We should not forget quality, safety, and satisfaction. And we know we have challenges. We know that the biggest challenge, I wish actually Abdullah Zainal is here. I wish you have invited the ministers of finance here today, because because item number 1 is funding, and next year, please invite the Minister of Finance so that we can challenge him here. He did not come. You know why? Because of my talk. So funding, and also we have, like any countries, we have resistance to change. Being a doctor, and I hope the doctors will pardon me, the most difficult people to resist change is the physicians. So we have to live with them. Now, we challenged our strategy through an internal consensus building, through our health workers in the Ministry of Health and the health workers both in the private and public arena in Saudi Arabia. But also we have gone through a national also consensus building for this strategy with the Shura Council, our parliament, and also different health leaders in Saudi Arabia. But we did not forget the international consensus building. We have actually experts that has studied our health reform from the United States, England, Europe, and different countries. And most of them agreed that integrated comprehensive healthcare system to be a national project is the way to go. And the last word they mentioned, this approach has been adopted and validated by a world-class healthcare system that we hope to achieve. Now, budgets, I know I have businessmen. I tried to remove those slides, but Muhammad told me you cannot remove money from business people, so I have put that one. So we know that the funding for quaternary care will at least need 1.8 million per bed operation, and the same thing for central beds and general hospitals. And also the number of physicians per bed is 0.7, and also how many staff per primary healthcare center. And I think you are interested in medications. We are spending close to 1.5 to 2 billion US dollars a year only for the Ministry of Health. So you may have to double it for the rest. And also we have to invest for training. I know there are leading people from American colleges and also universities. We have an investment of close to $150 million a year for training of our staff, and the same thing applies for ambulance and mobile clinics. So our integrated healthcare system is intended to develop, to actually go with those initiatives that we will implement in the coming few years. Now, unfortunately, our 10-year strategic plan is already out. The Arabic version is out 2 months ago. We are now finalizing the English version, which we will put on our website, which is open for you to know what we have in the coming few years. One thing which is important, there is a logo and a word down which says patient first. So we believe that you cannot do any healthcare system without putting the patient first, but you cannot read the words below, which is the words of His Majesty that I will mention later on. Now, I cannot leave this without mentioning that the Saudi initiative of mass gathering, we have the largest mass gathering in the world, which is Hajj. We receive close to 4 million a year. They come only for a week, and they gather in a narrow area. And we have developed over decades the world experience in how to manage mass gathering medicine, including infection control. And 2 years ago, we have launched an international conference, and also we have agreed with the World Health Organization and also with the CDC that Saudi Arabia will be the leading force and also will be the reference country for mass gathering medicine that we hope to deliver to the world. By the way, the clock you saw is Mecca clock. It is the tallest and the biggest clock in the world, which has been actually given by His Majesty King Abdullah to be a timing reference for the world, and actually it is available for all Muslims in the world as a reference. Our data for mass gathering medicine has been published in the Lancet, and there has been many publications that you are welcome to read and know about mass gathering medicine, and we will be starting training program next year in mass gathering medicine. Now, for us, we have to talk about innovation. I think Ministry of Health is no longer a healthcare only service provider. We believe Ministry of Health has to be involved in education, in research, and also in business initiatives. So we feel that healthcare and health finance solutions, health industry and technology transfer, and also evidence-based medicine, research, and performance measures cannot be forgotten in the healthcare system of Saudi Arabia. Now, those of you who are in the engineering and construction firms, we have in the coming 5 years, 190 hospitals to be built, 5 medical cities size of 1,500 beds with centers of excellence, and 1,400 primary healthcare centers. Those who would like to share with us the technology transfer, we are interested in the medical device technology transfer, pharmaceutical industries, and e-health initiatives. These are models for our engineers here in the audience about some of our hospitals and medical cities, and they are more than welcome to critique them. And less than 2 years ago, I have signed with the Secretary of Health of the United States in Geneva a memorandum of understanding that will actually strengthen our ties with the US, both in the field of clinical expertise and exchange, in the field of training, in the field of transfer of technology, and in the field of collaboration with infection control. We value this collaboration. I have put this slide to show you that the proposed healthcare investment that the Ministry of Health is commissioned to transfer the process of know-how, technical know-how, logistical support and expertise, and technology. There are opportunities for you to know, training for healthcare professionals, institutional partnership, public to private partnership, and transfer of technology and research, plus health facility development. In summary, healthcare is a promising avenue for collaboration, but it requires a robust business to government initiatives. Opportunities are numerous and can be identified through the Ministry of Health 10-year strategic plan. This plan has been presented 2 years ago in its first draft to His Majesty, but let me show you what he said. At the bottom, nothing is more precious than the health of citizens. That's his values, which we value and respect. Now, also, I cannot leave without putting the conjoined twins. This is the initiative of His Majesty King Abdullah. He has sponsored many twins, and these flags represent 16 countries where those poor twins came for and has been treated and taken care of and sent back to their home countries, and they were totally sponsored by His Majesty. So he is not only a leader, he is a child lover and helper. Thank you. My time is over. Thank you for yours.